Do you want to know how you can get paid to get a free massage? Or what about how you can continue getting free therapy after you run out of insurance coverage? These are just two of the ways I'm going to show you in this video on how to maximize your health benefits from work. Now, before divulging my deepest and darkest secrets, if you can all hit the like button for little baby Summer, because we know for every like this video gets, Summer here gets one cookie. Hey everyone, welcome back to my channel. I'm Cody. I work as a registered physiotherapist. Today's video is going to be very important because it's going to help you all better understand how to use your work health benefits. I'm going to do this by offering 7 tips and tricks I've learned over my career as a physiotherapist to help you maximize your work benefits, also known as extended healthcare benefits or private health insurance. Now make sure you watch all 7 tips and tricks because 2 of them will tell you how to get paid while getting a free massage, as well as how to continue getting free therapy after you've maxed out your coverage. Now if you're an employee of a business, chances are you have some type of health benefits from work. And each and every year, a substantial chunk of your salary goes into paying for this benefit plan. Which brings us to point number 1, you need to use your entire coverage each and every year. See, you spend several hundred up to several $1,000s each year paying into these benefit plans. Now, over a 20 to 30 year career, we're talking anywhere from $10,000 all the way up to $60,000 that you've spent into this benefit plan. And if you have never used them or you hardly use them at all, that's just money you've thrown out the window. You could have used that to go on nice vacations, put that towards a down payment on a home. You could have bought a really nice car. That's money you are never ever going to see again. So it's very important that you use these benefits each and every year. And remember, the purpose of these extended healthcare benefits is to help you pay for services not covered by provincial health insurance plans. For example, OHIP in Ontario. Remember, your employer wants you to use these benefits. They want you to stay healthy, they want you to be able to come to work every day, and they want you to be productive for their business. But millions of extended healthcare dollars go unused each and every year because people either don't know they have the coverage, they don't know what they're covered for, or they see no reason for them to utilize the services. Which brings us to tip number 2. You do not need an injury or be in pain to make the most of your coverage. There are countless benefits to using your private health insurance outside of pain and illness. Most of us sit at a desk 8 hours a day. We have horrendous posture and all that stiffness and stress on the body. That's just asking to turn into pain and injury further down the road. Another example is all of us being on our smartphones throughout the day. We're texting, we're on social media, or we're playing games like Candy Crush. That posture in our neck and that hunch, almost like Quasimodo in our back, that is just going to lead to horrendous posture down the road, a lot of pain, a lot of injury, and a lot of grief. In both of these cases, you're going to be using your benefits for preventative services, and most health insurance plans cover prevention. Which brings us to tip number 3, know your plan. Now you can call your insurance company yourself and you can find out exactly what you're covered for, what services, how much for each service, is there a deductible, meaning is there an amount you have to pay out of pocket with each visit, do you need a doctor's note for certain services? Or a trick that I recommend is when you find out which clinic you want to go to, on your first visit, hand the administrative assistant at the front desk your insurance card. The administrative assistant will then call your insurance company for you. They will find out exactly what you're covered for. Now this has 2 benefits for you. They're going to save you a lot of time. You don't have to sit on the phone for 20 to 30 minutes just waiting for the insurance adjuster to answer the phone. And number 2, that administrative assistant at the clinic does these all day, every day. They know exactly what to ask the insurance company to find out exactly what your plan is. When they're done, they're going to get the healthcare practitioner to explain to you exactly your plan, what you're covered for, and what your treatment plan is going to look like. Definitely get the clinic to call the insurance company for you. Tip number 4, be organized. Now with your health insurance plan, typically you're covered for certain products, like orthotics you put in your shoes or compression stockings that you'd wear at work. Now these products can be covered every year, every 2 years, or every 3 years. You want to know exactly when you're entitled to get another free pair of these products. If you're entitled to a free pair of orthotics every 2 years, you want to make sure you don't get a pair of orthotics every year because one of those years, that orthotic will not be covered and you're going to be on the hook for the bill. Or another scenario, if you're covered for free orthotics each year, make sure you don't go 2 or 3 years without getting a pair. You're just wasting that coverage you have. Another thing you want to be organized with is the submission of your claims. You want to make sure you submit your claims as soon as possible, and you can submit them one of 2 ways. You can do it yourself, known as an e-claim, done over the internet. Typically takes 1 to 2 days to get reimbursed, or you can have the clinic direct bill if they offer that. That means you don't have to pay any money up front. Now, the reason you want to submit your claims as soon as you can is because you want to make sure that there's no errors. You want to make sure that the insurance company is in fact going to cover the service. You would hate to be paying for a service 10 months of the year and not submitting those claims, and then wait all the way to the end of the year, submit all those claims together, and find out that they were denied or that they weren't covered 100%. And the second reason you want to make sure you submit your claims as soon as you can is cost of capital. You want to get that money reimbursed back to you so that you can spend it for other things or you can invest it. Now here's where I'm going to tell you how you can continue getting free therapy after you've maximized your coverage. And this is really just one way of doing so. What it is a healthcare spending account. You need to check your plan and see if you have a healthcare spending account. And what a healthcare spending account is it's a lump sum of money given to you that you can use for whichever service you like. So let's say regularly with your plan, you're given $1,000 a year for physiotherapy. And let's say you do 10 or 15 visits, you've used up your $1,000 worth of physiotherapy coverage, but you still want to continue doing physiotherapy. What are you going to do? Well, you're going to look at your healthcare spending account, and no matter how much money's in there, $100, $500, $2,000, you can use that money and direct it towards more physiotherapy. That is how you can continue getting free therapy after you've maximized out your coverage. But that's not the only way you can continue getting free therapy. Stay tuned, and I'm going to tell you the second way. But before I tell you that, let's move on to tip number 5, selecting which healthcare practitioner you see. Now, it's a very common question. Do I see physio, chiro, or massage therapy? Well, for your first visit, you're going to need to have a detailed assessment, you're going to need to be diagnosed, and a treatment plan is going to need to be formulated. And the two professions that have extensive training in this is going to be a chiropractor and a physiotherapist. So your first visit should be with one of those two. Now, how do we choose between seeing a physiotherapist or seeing a chiropractor on our first visit? Now, the way we're going to do this is we can choose one of 3 methods. Number 1, what are you familiar with and what are you comfortable with? If you've seen a physiotherapist in the past and you've been very comfortable and very happy with their service, go see the physiotherapist. Same thing can be said if you have a good previous history with a chiropractor. The second way to determine which one you should see is most clinics, when you go there, they offer a 10 to 15 minute free consultation. And what that is you sit down with the medical director of the clinic, they talk with you for those 10 or 15 minutes, try to find out exactly about your condition, and they will know who to refer you to, whether the physiotherapist or the chiropractor, and who's going to be best to see you. And the third way to determine who you're going to see, whether the physio or the chiro, is look at your coverage and see which services you're covered for. You might not have any chiropractic coverage, but have lots of physiotherapy coverage. Therefore, you're going to see the physiotherapist. Now, what about if you have coverage for both chiro and physio? My suggestion is always go with the one you have more coverage for. The reason for seeing the profession with the most coverage is because at a minimum, you're going to be seeing this person for 4 to 6 weeks. You would hate to get 1 or 2 weeks in and run out of coverage. And an added benefit is over the course of your treatment plan, if you do need to be referred out to one of those 2 other professions where you have less coverage, you're only going to be referred out for 1 or 2 visits, so you don't have to worry about running out of your coverage. Another word of advice for picking a professional, let's say you want to get a massage done, but you have no massage coverage. Then you'd want to look for physiotherapists or chiropractors that use massage or hands-on techniques as part of their treatment plans. And tip number 6 is the second way you can continue getting free therapy after you've run out of coverage. And that is with your spouse's work benefit plan. See, if your spouse has a plan, that means there's redundancies in coverage, meaning you can continue getting the therapy you've been getting, or you may even be able to get new services that weren't covered with your own plan. So the trick here is you compare and combine your 2 plans. And going further into maximizing your benefits, look at your children. Your plans typically cover all your children under the age of 18. There are numerous preventative and wellness services that children can benefit from, including things like massage, postural assessment, and corrective exercise prescription. Therefore, the key is making sure you use your coverage, your husband uses your coverage, you use your husband's coverage, and all of your children use both of your coverages. That is how you maximize your health benefits. Now, tip number 7 is what everyone's been waiting for, and that is how can you get paid while getting a free massage? Now, I'm serious. You can do this. And what we're going to do is called credit card hacking. Now, what that is if you have a credit card that has a point plan that rewards you with vacation and cashback options, you may elect to pay for your services upfront and be reimbursed later. Now, this means you don't let the clinic direct bill for you. It means you pay with your points-based credit card after your visit, you submit the claim yourself, and then get reimbursed. Now at the end of the year, you can use all those points you accumulated to go on a really nice vacation, or you can reinvest that back in your health and pay for a gym membership or some personal training sessions. So what's stopping you from using your benefits? They're free. You've already paid for them. And on top of that, you're strengthening the economy of all those self-employed health professionals. Are you worried about putting money up front? It literally takes 1 or 2 days to get your money reimbursed. And most of what's covered under these extended health benefits are for preventative services. Take care of yourself now so that in the future you're happy, healthy, and you don't have to worry about pain or injury. I'm going to end this video by just telling everyone out there, please use your benefits. You paid for them. Thanks everyone for watching. Now, if you're wondering how you can find a good physiotherapist, I made a video on this. It's going to be right up here. You can click and watch that video now. To everyone else watching, just make sure you hit that subscribe button so you're alerted of all my future videos and content. Please share this video with everyone you know, because everyone needs to start using their benefits.